So now that you understand different styles of responding to conflict, what do you do next? As we mentioned in earlier segments, conflict is a natural part of working in a healthcare team. Conflict management styles may vary. We have presented 5 different styles in managing conflict. For example, Dr. Miller was directing, Nurse Martinez was compromising and harmonizing, Discharge Coordinator Johnson was avoiding, Pharmacist Anderson was cooperating, and now we'll discuss how to properly respond to conflict. We will consider here the escalating conflict between Dr. Miller and the pharmacist Dr. Anderson. Pay particular attention to how the conflict was managed by both parties.
Has anyone called ICU yet? There should be a room ready by now.
I did, Dr. Miller. They're waiting for a patient to transfer to the floor, so we have room for our admit. But Francisco from the floor said he's still working on their discharge.
What's taking him so long? I talked with Francisco over an hour ago.
Excuse me, Dr. Miller. Hi. I know what's holding up the discharge. And if you give me a second, I can help you. We can come up with some ideas on how to get Mr. Hart home as soon as possible.
Okay. What are they?
Well, you see, Mrs. Hart, she's having difficulty giving the medication multiple times a day.
I know that. That's why I told Francisco to set up home health care.
Right, but Mr. Hart doesn't qualify for home health care, so she doesn't want it to go home with the arrangement the way things are.
So he doesn't qualify, there's nothing we can do. I'm just a doctor here trying to get things moving as fast as I can.
I know, but if you give me a second, I have some ideas. If we replace the current regimen with ceftriaxone alone, but for a 4-week course, that would work.
A longer course of ceftriaxone would work. Yeah. Okay. Send him home with ceftriaxone. And one more thing. I ordered some prophylactic antibiotics for him to take prior to any future dental procedures. If you could just explain to him the importance of this medication. Apparently his dentist and I are not on the same page.
Mr. Hart did mention that he didn't know that he should inform anyone about his history of endocarditis because he didn't realize it could recur. Now he knows how serious it could be.
So Dr. Williams didn't know of Mr. Hart's previous condition.
We will discuss a 3-step framework to respond to conflict. First, cool down. Once you detect a conflict, try to detach yourself from the situation, depersonalize from the conflict, and get yourself to a place where you can deal with the conflict. Try to understand your own and the other person's emotional response to conflict. Second, slow down. Stop to think about your goals, the relationship, and who has the power. Third, engage constructively by taking account of the time, place, and manner in which you respond to conflict. In step 1, cool down allows you to recognize and regulate your emotional response to the conflict, understand and respond to the emotion of the other person. Detect is to identify that you're in a difficult situation based on your stress level, physical symptoms, and thoughts. Detach is to separate yourself emotionally from the situation or relationship. This is difficult to do and takes practice. One strategy is to keep in mind your goals and interests by learning to identify the immediate task at hand. Depersonalize is to try to focus on the content of the issue and not the person. Put your energy into solving the current problem, which contributes to a productive outcome, instead of focusing on or blaming on the person, which contributes to an unproductive outcome. Deal is to manage the relationship and control your emotion by using strategies. Strategies include setting boundaries by creating some distance while cognitively reframing the conflict by re-examining the conflict for less threatening alternative explanations. This is a very functional option other than acting out or suppressing your emotions. Here is an example of pharmacist Anderson taking a deep breath before going forward with suggestion of different antibiotic combination. This allows time to detect, detach, depersonalize, and deal with the conflict on hand.
So he doesn't qualify, there's nothing we can do. I'm just a doctor here, trying to get things moving as fast as I can.
I know, but if you give me a second, I have some ideas.
Step 2 is to slow down. Think about your goals, relationship, and who has the power. Goals relate to the overall goal for both you and the other person. Relationship relates to the consideration of the past, current, and future relationship one has with the other person. For example, Dr. Miller should consider her relationship with her peers and colleagues, such as the pharmacist. Power relates to who has the power in the relationship. The various parties involved in this conflict have shared responsibility to take care of the patient and collaborate in the patient's best interest. But who controls the resources? Who stands to lose most if agreement isn't reached? Will power differentials have a different impact on each player? For example, Dr. Miller is not taking in consideration of relationship with a dentist who she already had a conflict with earlier in the day. Step 3 is to engage constructively, meaning to consider the time, place, and manner in which you respond to conflict. Time or timing relates to that in general. It's a good rule of thumb to address the matter as soon as practical, allowing for cooling off and for scheduling a mutually convenient time to talk. Place means to suggest a private place. Manner includes both verbal and nonverbal communication. Practice non-threatening verbal communication by presenting your perspective of the conflict and being open to a different perspective. Watch your word choice, using collaborative instead of confrontational or provocative language. For example, use I messages rather than blaming with the use of the word you. Move from being certain to curious about the other person's story. Avoid presenting your conclusions as the truth and avoid hyperbole with words like always or never. Reframe your experience by converting accusations, blame, and absolute truth to intentions versus impact, contribution to the conflict, and different perspectives. Use good eye contact and watch your posture, voice tone, and volume. Spend as much time listening as you do speaking. Take turns and do not interrupt when the other person is speaking. Be mindful and present and use active listening to demonstrate your listening and understanding of the other person's perspective. Be proactive and forward-looking. Your non-threatening and non-defense manner will facilitate a forward-looking plan of action. Build on any good guiding principles that will help you resolve the conflict, such as respectful relationship or patient safety. Here are 3 examples of how one engages constructively or not during a conflict. In Scene 1, Dr. Miller's timing was not ideal. She exhibited public display of frustration, and her behavior put everyone under stress. In Scene 2, Dr. Miller's tone of voice to Nurse Martinez was very harsh and confrontational by saying, "Francisco, I'm in the middle of a medical exam. Can you talk to the discharge coordinator and arrange home health nursing care if Mrs. Hart can't manage it herself?" In Scene 3, Pharmacist Anderson asks permission to discuss with Dr. Miller regarding Mr. Hart's treatment by coming to her station with a smile and respectful manner, keeping to the shared goal, and allowing Dr. Miller to speak while he listened. Key learning points for this segment include that conflict is a natural part of working on teams and in healthcare. The 3-step conflict response framework includes cool down, slow down, and engage constructively, of which verbal and nonverbal communication skills are key to that step. Next segment, we will explore effective communication skills essential to conflict management. As presented earlier, the manner in which you communicate is critical. This includes both verbal and nonverbal messages. In reflecting on the conflict situation you experienced, stated in the Segment 1 forum discussion, what steps did you do in response to the conflict? How did you cool down, slow down, and engage constructively? What could you have done differently in your verbal and/or nonverbal communication? We look forward to hearing about your discussions.